Welcome back to KPRC 2 Plus. I'm health reporter Haley Hernandez, and I'm joining you at this point in our broadcast so we can navigate healthcare together. Navigating healthcare coverage, specifically Medicaid, can be challenging to say the least, but it is important to understand that there are options if you need help. So I'm going to bring somebody else into this discussion. Joining us now is Vice President at United Healthcare, Monica Rivera. Good morning, Monica, and thank you for joining us so early this morning. Let's kick it off. Good morning. So let's kick it off with one important question. A lot of people might not realize that Medicaid is an option for them. So tell me, what is Medicaid and who exactly would it cover here in Texas?
Thank you, Haley. Thank you so much for having me. Medicaid is a health insurance program that is for a lot of different people, including some children, pregnant people, people with disabilities, and other people, for example, people that might have fallen off their parents' insurance at 26.
People who could be caring for children too. I mean, I think a lot of people might be surprised by the fact that they could be covered by Medicaid. Do you find that?
We find that, and I would encourage your viewers to go to medicaidhelper.com to see if they are eligible for Medicaid.
What do you find are some of the things that surprise people about Medicaid?
I think some of the things that people are surprised about is, for example, Haley, 30 million Americans did not have coverage during the pandemic. So as we think about access to preventive and treatment, that's a big number of people. The other thing that people would be surprised about is 43% of births every year are covered by Medicaid.
Oh, of births. So when someone is pregnant, if they think that they are in need of extra coverage, they should look into this.
I would recommend they go to medicaidhelper.com to see if they're eligible. But Medicaid does cover a lot of the pregnancies, including prenatal care, the actual birth, and some postnatal care for the baby and the mom as well.
Yeah. So why is it so important for individuals to get on this care and maintain this health coverage?
Haley, I think everybody really wants to navigate life and either work or go to school without really having to worry about a catastrophic disease here hitting them. So it's really around having access to services, both in the prevention end of the spectrum and if they need to for treatment.
But we are talking about people who are concerned about the cost of healthcare. So what could somebody expect to pay? Like, what's a spectrum that they could expect to pay with this kind of coverage?
So Haley, going back to your question before, what would be surprising to a lot of people is many of these plans are available at no cost or at very little cost to the end user. So again, encouraging them to go to medicaidhelper.com to see where they qualify and for what specific program. If they don't qualify, they can always look into a health insurance exchange, particular to Texas.
Yeah, I was going to ask you if you knew anything, if there was anything specific to Texas, because you know that we have our own challenges here in Texas that are a little bit different from some other parts of the country.
Right. And Texas in particular, so different, right, for the cities like Houston and Dallas to West Texas and access specifically to care there. So there is Medicaid coverage in Texas. And again, your viewers can go to medicaidhelper.com.
Okay. Is there a sign up period? Are we coming up to the enrollment period? What should people know about when and how to do that?
No, there's continuous enrollment, so they can go there and see if they qualify for enrollment.
All right. Thank you, Monica Rivera, Vice President at United Healthcare. Again, thank you for joining us so early this morning, and have a good rest of your day.
Thank you for having me, Haley. Have a great rest of the day.